in the body, providing support and protecting the pulp. The pulp is what contains the nerves and blood supply. So if you get a loss of enamel, that can expose the dentine, and that can cause sensitivity or pain. And if you experience loss of dentine, that can end up exposing the pulp, which can cause pain, infection, and potentially even death of the pulp. So what are the different types of oral diseases? Can you see it?
Yes.
Okay. So hi everyone. I'd like to first of all start by thanking Raj Uncle and Aranthi Auntie for kindly inviting me today. And I'd like to thank everyone here for coming tonight to listen to my talk. It's an honor to have the opportunity to talk to so many of you from all over the world. So thank you for having me.
Today, the guest speaker is Ms. Tharmara Kumar. Tharmara Kumar is a third-year dental student studying at King's College London. Prior to this, she achieved a BA First-Class Honours degree in English from King's College London. She has previously held the position of Editor-in-Chief for the KCL Student Dental Magazine, the King's Crown, a magazine which aims to inform students and the public about issues and topics within the dental sector.
தனி மனிதர்களாக நாடு எனும் எல்லைகளை கடந்து நாம் அனைவரும் இணைந்து செய்தும் இத்தியானமானது மகத்தானது. ஒவ்வொருவருடைய தனிமனித மேம்பாட்டுக்காகவும் வீடு, நாடு, உலகம் எனும் அளவிலான நோயற்ற, போரற்ற ஒரு சுமூகமான வாழ்விற்காகவும் பிரபஞ்சத்தை நோக்கிய ஒரு சக்தி வாய்ந்த வேண்டுதலாகவும் இது அமைகிறது. அன்பினியோர்கள் அனைவருக்கும் அன்பு மாலை வணக்கங்கள். இன்றைய நிகழ்வில் முதலாவதாக 20 நிமிடம் வரை தியானம் இடம்பெறும். அதைத் தொடர்ந்து பல் மருத்துவத்துறையில் இறுதியாண்டு மாணவியான செல்வி தாமரா குமார் அவர்களின் அருமையான பற்கள் பாதுகாப்பு பற்றிய சிற்றுரை நிகழும். அடுத்து மொழிபெயர்ப்பாளர் குமாரசாமி பிள்ளை ஐயா அவர்கள் சுருக்கமான மொழிபெயர்ப்பை தொகுத்தளிப்பார். அதைத் தொடர்ந்து பங்கு பெற்றவர்களின் கேள்வி பதில், கருத்தாடல் ஆகியன நிகழும். இப்போது தியான நிகழ்வினை திருமதி மைதிலி சக்திதாசன் மாஸ்டர் அவர்கள் நிகழ்த்துவார். Warm evening greetings to all. Today's order of events are as follows. First, there will be a meditation for about 20 minutes. Following that, Ms. Tharmara Kumar will be delivering a speech on the topic of how to look after our oral health. Her speech will then be translated briefly by Mr. Kumaraswamy Pillai in Tamil. Then the floor will be open to question and answers and discussion. Now I hand over to Mrs. Maithili Saktidasan, Master, to take us through the meditation.
Greetings, everyone. Everyone wants to have good physical health and happiness and peace of mind. They search for these things externally, but they are available from within us. The only way to achieve these is through meditation. Here we are following the Anapanasati meditation, which means observing your normal natural breath, inhalation and exhalation. This is a very simple meditation, yet it is very powerful. You do not need to hold your breath or chant any mantras. All you need to do is close your eyes and observe your breath. When you're observing your breath, thoughts will come, but you need to discard the thoughts and return to observing the breathing. After some time, thoughts will start to fade. Then the cosmic energy will enter through your head and penetrate the whole body, cleansing and energizing all the glands and cells in your body. Through regular meditation, we can gain a lot of benefits in terms of good physical health and mental health. For example, improved mental health in terms of peace of mind, contentment, calmness, happiness, and joyfulness. It helps to cope with stress, anxiety, and anger. Positive attitudes will increase and negative attitudes will start to disappear. Self-confidence and concentration will improve. As for physical health, the cosmic energy will help to heal any ailments in the body. It helps to manage chronic conditions effectively. You will feel more energetic in your day-to-day activities. Now I'm going to start to say how to meditate. Before and after meditation, you need to drink some warm water, which helps to prevent throat dryness. Sit in a comfortable position with your back straight. If you're sitting on a sofa or a chair, you may use a pillow or cushion to support your back. If you are wearing glasses, please remove them. Keep your feet crossed like this and clasp your fingers together like this and place them on your lap. Your body has to be relaxed without any tension. Close your eyes gently and start observing your normal, natural breath. Thoughts will come, but keep going back to observing your breath. A soft music will be played in the background to help with the meditation. Please do not open your eyes or release your hands until you're instructed to do so. தியானத்திற்கு முன்பும் பின்பும் இளம் சூடான நீரை அருந்தவும். சுகமான ஆசனத்தில் அமர்ந்து கொள்ள வேண்டும். கண்ணாடி அணிந்திருந்தால் கழட்டி விடுங்கள். உடல் இறுக்கமாக இல்லாமல் தளர்ந்தபடி இருக்க வேண்டும். 2 கைகளின் விரல்களையும் ஒன்றோடு ஒன்றாக கோர்த்து இப்படி மடி மீது வைத்துக் கொள்ளவும். தரையில் உட்கார்ந்திருந்தால் சம்மட்டி போட்டு கொள்ளுங்கள். நாற்காலியிலோ அல்லது சோபாவிலோ உட்கார்ந்திருந்தால் பாதங்களை ஒன்றின் மீது இப்படி குறுக்காக வைத்துக் கொள்ளவும். கண்களை மெதுவாக மூடிக்கொண்டு நம்மில் இயல்பாகவும் இயற்கையாகவும் நடக்கும் சுவாசத்தின் மீது கவனத்தை செலுத்தவும். எண்ணங்கள் வருவது இயற்கை, ஆனால் அதை விட்டு திரும்பவும் சுவாசத்தை கவனிக்கவும். இனிமையான இசை ஒன்று வழங்கப்படும். நாங்கள் அறிவிக்கும் வரை கண்களை திறக்காமல் கைகளையும் பிரிக்காமல் இருக்கவும். இப்போது மெடிடேஷனை தொடங்குவோம். Please slowly return to your normal self. Release your hands and put the tips of your fingers on your eyes and count to 5 seconds. 5, 4, 3, 2, 1, 0. Then slowly open your eyes. Now please drink some water. We have now completed our powerful group meditation. Clap your hands to applaud yourselves.
Today, with the goodness of the energy of the universe, we all meditated together in a powerful union for our peace, tranquility, and health. When our meditation is done collectively together in many countries, it becomes a social force strong enough to expand across the countries to the whole world. We would like to thank all the participants who took the time to meditate with us today. We would also like to thank PSSM and PMC India for enabling this session. May the whole world be blessed with peace, prosperity, and well-being. Thank you. PSSM தமிழ் ஐரோப்பா குழுவின் வழிகாட்டுதலில் இன்று நாம் அனைவரும் இணைந்து ஒரு அமைதியான தியானத்தை மேற்கொண்டோம். தனி மனிதர்களாக நாடு எனும் எல்லைகளை கடந்து நாம் அனைவரும் இணைந்து செய்தும் இத்தியானமானது மகத்தானது. ஒவ்வொருவருடைய தனிமனித மேம்பாட்டுக்காகவும் வீடு, நாடு, உலகம் எனும் அளவிலான நோயற்ற, போரற்ற ஒரு சுமூகமான வாழ்விற்காகவும் பிரபஞ்சத்தை நோக்கிய ஒரு சக்தி வாய்ந்த வேண்டுதலாகவும் இது அமைகிறது. உணவு உடலுக்கு மட்டுமே உரித்தாகிறது. ஆனால் எண்ணங்களோ எல்லைகளை கடந்து இயங்கக்கூடியது. இணையதளத்தின் ஊடான இந்த இணைவு அனைவரும் ஒரே நோக்கு கொண்டு இணையும் போது சக்தி வாய்ந்ததாக அமைகிறது. இதிலே பங்கு பற்றிய அனைவருக்கும் இவ்வரிய சந்தர்ப்பத்துக்கு வழிகோலிய பிஎஸ்எஸ்எம் அமைப்பு நிர்வாகிகளுக்கும் எமது அன்பான நன்றிகள். வாழ்க நலமுடன், வாழ்க வளமுடன்.
Today, the guest speaker is Ms. Tharmara Kumar. Tharmara Kumar is a third-year dental student studying at King's College London. Prior to this, she achieved a BA First-Class Honours degree in English from King's College London. She has previously held the position of Editor-in-Chief for the KCL Student Dental Magazine, the King's Crown, a magazine which aims to inform students and the public about issues and topics within the dental sector. In addition to this, she is also a volunteer for HEU, an organization started by KCL, dental students focused on delivering oral hygiene care and promoting oral health awareness to underprivileged communities in Nepal. She is also part of the non-profit organization, KCL Smile Society, which delivers oral health care, advice to children in primary schools, and raises awareness about oral health diseases through fundraising initiatives. Today, her talk is entitled, How to Take Care of Your Teeth. On behalf of everyone here, and I would like to welcome Ms. Tharmara Kumar. We're all excited to hear your speech. Please welcome Tharmara.
Hi, thank you. I'm just going to share my screen. Can you see it?
Yes.
Okay. So hi everyone. I'd like to first of all start by thanking Raj Uncle and Aranthi Auntie for kindly inviting me today. And I'd like to thank everyone here for coming tonight to listen to my talk. It's an honor to have the opportunity to talk to so many of you from all over the world. So thank you for having me. So tonight I'm going to talk to you about the importance of oral health, why you should care about your oral health, and what you can do to maintain good oral health. Okay, so why is oral health important? Well, according to the World Health Organization, oral health is a key indicator of overall health, well-being, and quality of life. Poor oral health can actually lead to impaired functions, where your ability to speak, smile, eat, taste, sleep, and even socialize can be impacted. It can also lead to economic strain on patients, families, public, oral health providers, and governments across the world due to the cost of dental treatment. Poor oral health can also lead to oral diseases like gum disease and tooth decay. However, these are largely preventable, and they can be treated in their early stages with good oral hygiene, but they still pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death. It is estimated that oral diseases affect nearly 3.5 billion people. There's also a proven relationship between oral and general health. Studies have shown that untreated oral diseases may increase the adverse health conditions. So maintaining good oral hygiene and taking care of your oral health is important in not just improving your oral health, but your overall well-being. So you may have heard the phrase, your eyes are the window to the soul. In the same way, you'll see many articles out there that say your mouth is the window to your overall health. For example, diabetes is linked with gum disease and vice versa. So diabetes can also lead to gum disease. Also, a high consumption of sugars can not only lead to tooth decay, but it can also lead to obesity. So oral health can impact your overall health and affect your everyday life. So how do we maintain good oral health and prevent the progression of oral diseases? So it is essentially about keeping your gums and teeth healthy. So make sure you're brushing your teeth twice a day with a fluoridated toothpaste. So you can use either a manual or electric toothbrush, and both are equally effective. But electric toothbrush can be beneficial if you struggle to hold a manual toothbrush, and some of them also have a timer for 2 minutes, so you know how long you're brushing your teeth for. And the general rule is to brush your teeth for 2 minutes before breakfast when you first wake up in the morning and before you go to bed. So you may be wondering, what is a fluoridated toothpaste? So any brand that you find in the supermarket, like Colgate and Sensodyne, will contain fluoride. So just check the ingredients on the back if you're unsure. And you're probably wondering, why do you need a toothpaste that contains fluoride? Well, it's a naturally occurring mineral that helps prevent tooth decay, and it's found in most water supplies in the UK. So when brushing your teeth, remember to spit after brushing. Do not rinse, as this will wash away all the fluoride that you've just coated your teeth in, and that's what you need to prevent tooth decay. And that's the same reason for not using mouthwash straight after brushing your teeth. So wait at least 20 minutes after brushing to use mouthwash if you want to. And remember to also change your toothbrush or toothbrush head if you're using an electric toothbrush every 1 to 3 months to make it more effective. Next, remember to floss at least once a day in between your teeth to remove any food and bacteria. So you can either use the threaded floss that you can see here or these TP interdental brushes. Just ask your dentist for advice on which TP interdental size brush to use if you are unsure. Thirdly, maintain a healthy diet. So that means limiting your daily sugar intake. This means cutting down on biscuits, chocolates, fizzy drinks, and sweeteners like honey and syrup. And finally, make sure you have regular checkups with your dentist and dental hygienist. So they'll help you look after your teeth and see if you're at risk of any oral diseases and help you stop them from progressing. Now, you may be wondering, how does brushing, flossing, and eating a healthy diet actually help keep my gums and teeth healthy? Well, essentially, they prevent the buildup of plaque on your teeth. So buildup of plaque is what causes most oral diseases like gum disease and tooth decay. So what is plaque? It is a white or yellow sticky film of bacteria that constantly forms on teeth. So after you eat sugary or starchy foods like bread and sweets, the bacteria in the plaque break them down and produce acids. And these acids can erode the surfaces of your teeth. So if plaque is not removed, it will harden into calculus, which is also known as tartar. And it can continue to irritate your gums and wear away your teeth if it continues to build up. So plaque is removed with brushing twice a day with a fluoridated toothpaste, flossing, and eating a healthy diet. So to get a better understanding of how oral diseases can start and progress and what the actual importance of oral health is, I'm just going to give you a brief explanation of the structure of the tooth. So teeth are composed of enamel, dentine, and pulp. Enamel is the protective outer layer of the teeth, and that covers the dentine. It's also the hardest substance found in the body. Dentine is the second layer and the second hardest tissue in the body, providing support and protecting the pulp. The pulp is what contains the nerves and blood supply. So if you get a loss of enamel, that can expose the dentine, and that can cause sensitivity or pain. And if you experience loss of dentine, that can end up exposing the pulp, which can cause pain, infection, and potentially even death of the pulp. So what are the different types of oral diseases? Well, there are many, and unfortunately, this presentation will go on for days if I spoke about them all. So I'm just going to talk about these 3 common ones. So the first one is gingivitis, which is mild gum disease. And then if this is untreated, it can progress onto periodontitis, which is known as severe gum disease. And lastly, we have dental caries, which we know is tooth decay. So this is what a healthy mouth can look like. So this first picture shows the healthy mouth of someone with South Asian origin. So you can see pigmentation in their gums. And then this next picture shows the healthy mouth of a Caucasian person, where the gums are more pink and are clearly lacking pigmentation. So let's firstly talk about gingivitis, mild gum disease. So it is essentially inflammation of the gums surrounding your teeth. And what you get is redness and swelling of the gums and bleeding on brushing. It's a common disease, and it's completely reversible with good oral hygiene, such as brushing and flossing. However, it's caused by the buildup of plaque. So you can see here there's an arrow pointing to some white substance here near the margin of the teeth, just above the gum. And that's the plaque that's building up and causing this gingivitis and inflammation of your gums. So periodontitis is the severe form of gum disease. So it's chronic inflammation of the gums surrounding your teeth. It is also a common disease like gingivitis. However, the effects of it are irreversible. So if gingivitis is not treated, it can lead to infection, the formation of an abscess, which is a painful collection of pus caused by bacterial infections, and potential tooth loss. So the signs of periodontitis include gingivitis plus recession of your gum. This is where they start to pull away from your teeth, and that leads to the formation of pockets in your gums. You can also experience bone loss. The teeth can become more mobile, and eventually they may fall out. And you can also get tooth drifting and bad breath. So the factors that increase your susceptibility to periodontitis include smoking, diabetes, pregnancy, medications for hypertension, so high blood pressure, epilepsy, and autoimmune diseases, and also genetic factors. And lastly, I'm going to talk about dental caries, which is tooth decay. And this is caused by the acids produced by bacteria in the plaque, wearing away tooth surfaces to form holes in your teeth known as cavities. So they can form anywhere on the teeth and in between teeth. And the signs of it include, you can get these white, brown, or black spots on your teeth. You can also get pain in your teeth, and you can experience this sharp pain when you eat or drink hot, cold, or sweet things. So this is when you experience sensitivity. It's also a common disease, and it's actually reversible in its earliest stages with the help of minerals in saliva, which can repair any surface affected by tooth decay in its earliest stages. So this diagram on the right shows how tooth decay starts off in the enamel, which was the outer surface of the tooth, and it can continue to progress into the dentine and even into the pulp if it isn't treated. And once it gets into the pulp, it can infect it, and that could lead to infection, inflammation of the pulp, the formation of an abscess, and even potential tooth loss. So to prevent these diseases from occurring and leading you to potentially losing your teeth or experiencing painful infections, good oral hygiene is key. So remember, oral health impacts your overall health and can affect your quality of life. With good oral hygiene, you can prevent gum disease and tooth decay. So see your dentist straight away if you experience any signs or symptoms of gum disease or tooth decay, because the earlier the diagnosis, the more chance you have of stopping its progression and even reversing the effects before it becomes untreatable. So I understand that was quite a lot of information that we went through tonight, and I appreciate if not all of it went in. So here are the main points for you to take away. So make sure that you brush your teeth twice a day with a fluoridated toothpaste. Make sure that you're flossing once a day in between your teeth, that you're maintaining a healthy diet and limiting your sugar intake, and you're regularly seeing your dentist and dental hygienist. So thank you all very much for listening, and thank you to Raj Uncle for doing such an incredible job of organising this meditation group. Meditation can really benefit everyone in a number of ways, as I'm sure you all know, but it can actually be really helpful for benefiting your oral health. So when we get stressed or experience anxiety or extreme emotions like anger or frustration, sometimes we clench our jaw and we can grind our teeth. And that can cause your teeth to break down and wear away. It can cause your jaws to become really painful. You can also experience face, neck, and shoulder pain, headaches, earache, and even disturbed sleep. So studies have shown that meditation and mindfulness can actually help reduce clenching of your jaws and can offer a more relaxed sleep because it's combating that stress and frustration or anxiety you may be feeling. So meditation can really benefit your overall health. So thank you again to Raj Uncle for all your efforts in creating this group and bringing together people from all over the world to interact and broaden their knowledge and perspective on a variety of topics. We're all extremely grateful and appreciative of your hard work that goes into actually organising this talk, and I feel extremely honoured to be able to be a part of it and present to you tonight on the importance of oral health. So thank you very much for listening. I'll be happy to answer any questions you may have.
Thank you very much, Ms. Tharmara Kumar, for your excellent speech, from which we've learned a great deal about the importance of oral health, which helps the overall health of the body as well. And we are so proud to have you here with us, and we are honored that you've come and given us this speech. We've learned a great deal, as I said, gingivitis and periodontitis and tooth decay, and the progression, how we need to keep an eye on things and how we need to maintain a good oral health and so on. And now Mr. Kumarasamy Pillai is going to give a brief summary of the speech in Tamil. Mr. Kumarasamy Pillai, please welcome.
அனைத்து மாஸ்டர்ஸுக்கும் இது இதயபூர்வமான வணக்கம். இப்பொழுது நான் தமாரா குமாருடைய உரையின் தமிழாக்கத்தை, தமிழ் தொகுப்பை உங்களுக்கு வாழ்வதில் மகிழ்ச்சி அடைகின்றேன். முதலில் எதற்காக நாங்கள் வாயின் நலத்தை பேண வேண்டும் என்பதை பற்றியும் அது எப்படி நீங்கள் பேணலாம் என்பதை பற்றியும் நான் கூற விரும்புகின்றேன். முதலாவது வாயின் நலம், ஆரோக்கியம் மிக முக்கியமானது. எதற்காக நாங்கள் இதற்கு முக்கியத்துவம் கொடுக்க வேண்டும் என்றால், உலக நல அமைப்பின்படி மொத்த உடல்நலத்திற்கும் நன்னிலைக்கும் தரமான வாழ்க்கைக்கும் நலம் வாய் நலம் மிக இன்றியமையாதது என்பது எல்லோரும் அறிந்த விஷயம். முதலாவது வந்து குறைபாடுள்ள வாய் நலம் உங்களுடைய ஆற்றலை, அதாவது பேசும் ஆற்றல், சிரிக்கும் ஆற்றல், உறவு, நித்திரை, சமூக உறவு ஆகியவற்றை பாதிக்க செய்யும். இப்ப நாங்கள் வந்து அநேகமாக பல் சம்பந்தமான நோய்கள் தவிர்க்கக்கூடியவை. அது முதல் ஆரம்ப கட்டத்திலேயே நாங்கள் அதை கண்டுபிடித்தால், சுகாதாரம் சரியில்லை கண்டுபிடித்தால் அவைகளை சிகிச்சை மூலம் மாற்ற முடியும். கிட்டத்தட்ட 3500 கோடி மக்கள் உலகளாவிய ரீதியில் இந்த நோயினால் பாதிக்கப்பட்டிருக்கின்றார்கள். அடுத்ததாக நீரிழிவு நோய்க்கும் இந்த ஈறு தொடர்பான இதுக்கும் தொடர்பு இருக்கின்றது. அது மட்டுமில்லை, அதிக அளவில் சர்க்கரையை பாவிப்பதும் இதுக்கு ஒரு காரணியாக கூறப்படுகின்றது. எப்படி நாங்கள் நல்ல உடல் நலத்தை, வாய் நலத்தை பேணலாம், பராமரிக்கலாம் என்று பார்த்தால், அது உங்களுடைய ஈறுகள், பல்லுக்குடைய உங்களுடைய ஈறுகளையும் பற்களையும் சுகமாக ஆரோக்கியமாக வச்சுக்கதல் வேண்டும். அதற்கு என்ன வழிமுறைகள் பல இருக்கின்றது. அவற்றை ஒரு சில என்றால், ஒரு நாளைக்கு 2 முறையாவது குளோரினேட் கலந்த பல் பசையினால் உங்கள் பற்களை சுழற்ற வேண்டும். மற்றது பல் ஈறுகளுக்கு இடையில் உள்ளவற்றை சுத்தம் செய்ய வேண்டும். அடுத்தது நல்ல ஆரோக்கியமான உணவு உண்ண வேண்டும். உங்களுடைய சர்க்கரை உட்கொள்வதை குறைக்க வேண்டும் அல்லது கட்டுப்படுத்த வேண்டும். அடுத்ததாக ஒழுங்காக பல் மருத்துவரிடம் சென்று உங்களுடைய நலத்தை சரி பார்த்து கொள்ள வேண்டும். அடுத்ததாக எப்படி நாங்கள் வாய் நலத்தை பாதுகாக்கலாம் என்று பார்க்க போனால், முதலாவது முக்கியமானது என்றால் இந்த பற்களில் படலம் ஆரம்பிப்பதை தடுக்க வேண்டும். இப்ப நீங்க இந்த பற்படலம் தான் பொதுவான வாய் நோய்களுக்கு அல்லது ஈறு நோய்களுக்கு அல்லது பல் சிதைவுகளுக்கு காரணியாக இருக்கின்றது. அப்ப ஒரு இது என்ன பண்ணுகின்ற வெள்ளையில மஞ்சளான ஒரு பாக்டீரியா நுண்ணுயிரியல் கொண்ட படை ஒன்று பல்லில் படவும். அப்ப நீங்கள் சாப்பிட்டோன்னு குறைவாக அந்த அநேகமாக சர்க்கரை உணவுகள் அந்த போன்ற பான் இனிப்புகள் போன்றவற்றை சாப்பிடும் பொழுது இந்த நுண்ணுயிர்கள் வந்து பல்லிலே தாக்குவதாலே அது பற்களை பாதிக்கின்றது. அப்படியான நேரத்திலே ஒரு அமிலம் பல்லிலே சுழந்து இந்த பற்களை சேதமடைய செய்கின்றது. அப்ப முதலாவது வந்து இந்த படலம் வந்து நாங்கள் ஆரம்பத்திலேயே அகற்றாவிட்டால் அது கடுமையாக வந்த உடனே அது வந்து ஒரு காரிய உண்டாக்கும். அதாவது ஆங்கிலத்தில் வந்து சொல்வார்கள் டாட்டால். அதற்கு தான் நாங்கள் கவனமாக இருக்க வேண்டும். அடுத்ததாக பல்லுடைய அமைப்பு எப்படி இருக்கிறது என்று நாங்கள் பார்த்தோம் என்றால், அந்த பல்லில 3 இருக்கிறது. ஒன்று வந்து எனாமல் என்றது வந்து பல்லுக்கு வெளிப்புறத்தில் ஒரு வெள்ளை நிறம் உள்ள ஒரு சைன் பண்ணி கொண்டிருக்கும். அடுத்தது டென்டின். அப்ப அதற்கு டென்டின் என்றது பல்லில் ஒரு எலும்பு. பல்ப் என்றது பற்கூழ். இப்ப இவை 3 தான் இந்த இதுல உள்ள பல்லிலே உள்ளன. அடுத்தது வந்து எனாமல் என்பது அந்த வெளி இருக்கிறது வந்து அந்த பல்லுக்களை பாதுகாக்கின்றது. அப்ப அதை நாங்கள் வந்து அதுக்கு பின்பு இருக்கிறது தான் எறும்பு. இப்படியான அமைப்பு உள்ளத பொழுது நாங்கள் எப்பொழுதும் வந்து சுத்தமாக வைத்திருக்க வேண்டிய கடமை எங்களுக்கு இருக்கின்றது. அடுத்ததாக நோய்கள், வாய் சம்பந்தப்பட்ட நோய்கள் பல இருக்கின்றன. அவற்றில் நான் முக்கியமாக 3 நோய்களை இங்கே குறிப்பிட விரும்புகின்றேன். ஒன்றை ஆங்கிலத்தில் ஜிஞ்சிவைட்டிஸ் என்பார்கள். இது வந்து பல் ஈறில் உள்ள ஒரு அலர்ச்சி என்ற பொழுது வீக்கம். இது வந்து ஒரு ஆரம்ப கட்டத்திலே மென்மையான நோய் என்றே சொல்லலாம். அடுத்தது மற்றது வந்து பற்புற திசு நோய் என்று சொல்வார்கள். இது வந்து ஒரு பாரதூரமான ஒரு ஈறு நோய். இதனால் கவனமாக இருக்க வேண்டும். அடுத்தது வந்து டென்டல் கேரிஸ் என்று சொல்வார்கள். இது வந்து பல் சொத்தை என்று சொல்லலாம். அடுத்ததாக ஒரு எப்படி நான் இந்த படத்துல உங்களுக்கு காட்டியிருக்கேன், ஒரு ஆரோக்கியமான வாய் எப்படி இருக்க வேண்டும் என்பதற்கு இந்த படம் உங்களுக்கு ஒரு சார்ந்து எடுத்துக்காட்டாக நான் கூறியுள்ளேன். அடுத்ததாக பல் ஈறு அழற்சி நோய்க்கு என்ன அறிகுறி என்று பார்த்தா இது ஒரு வீக்கம் இருக்கும். ஈரை சுத்தி இந்த பல்களை சுத்தி ஒரு அழற்சி இருக்கும். அதுல வந்து அறிகுறிகள் என்னன்னு பார்த்தால் அது சிவப்பு நிறமாக இருக்கும், வீங்கி இருக்கும். அதோட நீங்கள் பல் சுரக்கும் பொழுது இரத்த கசிவு ஏற்படலாம். மற்றது சில பொதுவான நோய்கள் இருக்கும். மற்றது ஆனா ஒன்று வந்து இதை நாங்கள் சிகிச்சை மூலம் மாற்றிக்கொள்ளலாம். அதாவது அடுத்தது இப்படியான அந்த ஒரு இதில் கவனீனமாக இருக்கக்கூடாது என்பதை நான் இங்கு கூற விரும்புகிற கருத்து. அடுத்ததாக மற்ற நோய் என்னது சொன்னால் பற்புறத்தில் உள்ள நோய். இப்ப பற்புறத்திலே திசு நோய் என்று சொன்னார்கள். திசு நோய் என்பது இது ஒரு குரானிக் இன்ஃப்ளமேஷன், அதாவது வந்து ஒரு நாள்பட்ட ஒரு வீக்கம். அப்ப இது வந்து இந்த ஈறுகளை சுத்தி இருக்கும். அதுக்கு பொதுவான அது வந்து கொஞ்சம் இந்த நோய் கொஞ்சம் மாற்ற முடியாத ஒரு நோய் என்றுதான் கருதப்படுகின்றது. மற்றது பல் ஈறுகளை அழற்சி இருக்கிறது. அதை வந்து நீங்கள் ஆரம்பத்திலேயே கவனிக்காவிட்டால், அதுக்குரிய சிகிச்சை அளிக்காவிட்டால் அது பாரதூரமான விளைவுகளை ஏற்படுத்தும். அடுத்தது வெவ்வேறு குறிகள் போட்ட படங்கள் உங்களுக்கு காட்டினேன், நீங்கள் பார்த்திருப்பீர்கள் நினைக்கின்றேன். அடுத்தது நாங்கள் வந்து டென்டல் சொத்தை, இது வந்து அமலங்கள் நாங்கள் சாப்பிடும் பொழுது இந்த பிளேக்கும் பொழுது இந்த அமலங்கள் ஏற்பட்டு அந்த பல்களை பாதிப்பதனால் வந்து இந்த பிரச்சனை ஏற்படுகின்றது. இந்த அறிகுறிகள் பொதுவாக வந்து வெள்ளை அல்லது கருத்தான பல் நிறத்தில் இருக்கலாம், பல்லில் நோய் இருக்கலாம். மற்றது இது வந்து ஆரம்ப காலத்திலே நீங்கள் இந்த நோய் கண்டு அறிந்தால் அதற்கு சிகிச்சை அளிக்கலாம். அது அர்த்தம் மட்டுமில்லை, இதை நாங்கள் கவனிக்காவிட்டால் இது பாரதூரமான விளைவுகளையும் உடல்நலத்தின் பாதிப்பையும் ஏற்படுத்தும். இந்த படத்திலே வெவ்வேறு விதமான இதுகள் எப்படி ஆரம்பிக்கின்ற படத்திலே நான் விவரித்துள்ளேன். நான் வந்து உங்களுக்கு வீட்டுக்கு உங்களுக்கு முக்கியமான செய்தி இங்க கூறுகிறது என்றால், தினமும் புளோரைட் கலந்த பற்பசையினால் 2 முறை பற்களை சுத்தம் செய்யுங்கள். சுத்தம் துப்பி விடுங்கள். ஆனால் அதை வந்து வாயை கொப்பளிக்கிறத குறைத்துக் கொள்வது நல்லது. மற்றது ஈறுகளுக்கு இடையில் உள்ள இதை அது ஒரு நாளைக்கு ஒரு தரமாவது நீங்கள் துப்புரவாய் வைத்திருக்க நல்லது. மற்றது ஆரோக்கியமான உணவு உண்ண வேண்டும். சர்க்கரையை சாப்பிடுவதை குறைத்துக் கொள்ள வேண்டும். மற்றது நீங்கள் ஒழுங்காக உங்களுடைய பல் மருத்துவரையும் பார்ப்பது மிக இன்றியமையாது ஒன்று என்று நான் கருதுகின்றேன். அடுத்ததாக வாயை நாங்கள் நலத்தை கவனிக்காவிட்டால் எங்களுடைய மொத்த உடல் நலத்தை பாதிக்கும். அந்த பாதிப்பு ஏற்படுத்தினால் எங்களுடைய தரமான வாழ்க்கையை நாங்கள் அனுபவிக்க முடியாது. இப்ப நாங்கள் வந்து நல்ல ஆரோக்கியமான நல்ல ஒரு சிகிச்சை முறையை அல்லது கவனிப்பது என்றால் நாங்கள் பல் பாதுகாப்பாக வைத்துக் கொள்ளலாம். இப்படியான ஒரு பிரச்சனை வளர்ந்த பொழுது அதை தாமதிக்காமல் அனுபவித்த உடனே எங்களுடைய பல் மருத்துவரை பார்த்து இதுக்கு உரிய செயல்பாடுகளையும் எடுத்தால் பல் சிதைவுகளையும் ஈறுகளையும் பாதுகாத்து கொள்ளலாம். எவ்வளவு நீங்கள் சீக்கிரத்தில் இதுக்கு உரிய சிகிச்சையை பெறுகிறீர்களோ அது உங்களுடைய வாழ்க்கையை மாற்றும் மட்டுமில்லாமல் இப்படியான வியாதிகளை மாற்றி நலமாக வாழ்வதற்கு உதவியாக இருக்கும். அடுத்த கடையாக நீங்கள் இன்று இதை அமைதியாக கேட்டதற்கு நன்றி. அடுத்ததாக வந்து உளவியல் ரீதியாக இந்த இதுகளை மாற்றலாம். குறிப்பாக மன அழுத்தம் தான் இப்படியான உடல் நலப்பு பொருளாதாரங்களுக்கு காரணம். நீங்கள் தினமும் நிகழ்காலத்தில் வாழ்ந்து தியானத்தை கடைபிடித்தால் நிச்சயமாக இது ஒரு தரமான வாழ்க்கையை உங்களுக்கு அமைக்கவும் உடல் நலத்தை பேணவும் உதவியாகும் என்று கூறி இதுவரை என்னுடைய உரையை கேட்டதற்கு நன்றி கூறி விடைபெறுகின்றேன். நன்றி, வணக்கம்.
நன்றி குமாரசாமி மாஸ்டர் அவர்கள். மிகவும் அழகாக நீங்க உங்களுடைய ஸ்பீச்சை மொழிபெயர்த்திருக்கிறீங்க. அது எவ்வளவு கடினமான விஷயம் என்று எல்லோருக்கும் தெரியும். நீங்கள் ஒன்று கூட விடாமல் சரியாக எல்லாத்தையும் பண்ணினதுக்கு ரொம்ப நன்றியை தெரிவித்துக் கொள்கிறேன். Miss Tharmara, you've really done a very good speech here, and furthermore, you've said about the meditation, how the meditation also helps with calming yourself, and I've learned a new thing about not to grind my teeth, even when I'm very angry. That's very good information. Thank you so much. Now I'm sure everyone will want to ask you some things or share their comments with you. So I would like to invite everyone in the audience to give their comments, or if you have any questions or anything, Ms. Tharmara is waiting to answer you as well. So if anybody is interested to say anything, please raise your hands.
So I just noticed in the chat there's one question that I can answer. It asked, is denture bridge good for 2 missing teeth?
Okay.
So with that, with a denture, it's something that's removable. So if you are happy to kind of like having to take it out and clean it and then having to put it in when you need to eat, then it's good. The thing with a bridge, it's more permanent, so you don't have to ever remove it, and it makes it easier than having a denture. But obviously it kind of like depends on where these missing teeth are, and what you would prefer. So it's really up to you. But yeah, I think if it's like missing teeth near the front, that you might want to go for a bridge, and if it's missing teeth at the back, you might prefer a denture. Because obviously if it's at the front and you don't have your denture on, it's more visible, it doesn't look aesthetically pleasing. So yeah, I hope that helps answer your question.
I'm sure it has. It has answered the question, I'm sure. Kanguga has raised a hand.
Hello.
Hello.
It's a very good informative speech. I just want to ask you something, but unfortunately slightly advanced, but you don't mind in, advanced means not for you, not for us. If a person who has the lower density bones, like osteoarthritis or osteoporosis, those sort of things, they prescribe alendronic acid. Yeah, they say it can have an impact on your oral health. Is it true?
I'm not actually too sure about that. So I'm afraid you'd have to ask someone who's a little bit more experienced than me to answer that question, I'm afraid.
All right, okay.
Yeah, thank you for the question.
Okay, thank you.
Thank you. Is anyone else ready to ask anything or say your comments? Mr. Kumarasamy Pillai.
First of all, I would like to thank you for the very, very detailed, informative information you provided to us. Actually, very useful. Daily, or experience these type of problems. Actually, there are so many things which we have refreshed it. Thank you very much. I would like to ask one question. When you say brush your teeth twice a day, that's okay. I do agree we have to do it. But one thing I can understand is spit, but don't rinse. Actually, what we do normally, even after you have your meals, we are asked to rinse our mouth with clean water. Why is that you are telling them not to rinse? That's what I would like to know from you. What is the danger in rinsing?
So it's just straight after when you brush your teeth in the morning and before bedtime. Just spit and don't rinse your mouth with water, because it's just going to remove all the fluoride from the toothpaste that you just put on your teeth. So you want to wait about 20 minutes for it to actually have an effect of the fluoride on your teeth. And that can help repair your teeth a little bit after you've eaten. But after you eat, so like say you've had lunch, it's okay to then like rinse out your mouth, but just make sure after you brush your teeth to not rinse after 20 minutes.
So that means the morning we can allow at least about 20 minutes, and then after that. But while after meals, actually we have to rinse our mouth. That's the thing that normally we do.
Yeah, that's fine.
That's okay.
That's okay. It's just after you brush your teeth, don't rinse it straight away.
Okay, thank you.
Okay, thanks.
And அடுத்ததாக Dr. Satha Master.
Good evening. Thanks, Tharmara Master, for excellent presentation. I was really impressed about your few factors you were mentioning about healthy diet. That always people say, but you impressed the way you said. At the same time, you were saying about brushing and leaving for half an hour, and then you have to do the mouthwash. People tend to do it all together, in a hurry. That's the easy way out. Then the other thing is, actually, people to, first time, this is a personal thing, first time I entered into dental faculty, but I didn't want to go. I somehow felt I wanted to have more communication rather than maybe a wrong or right impression, I don't know. This was in Sri Lanka. I didn't want it, so I went back and did my medical career. But I didn't lose out, but at the same time, you brought that psychological aspect as well. People could be anxious and you were considering your patients in that aspect and how the meditation will help. So that was a very good aspect. You brought it here. It would be really, for any ailment, meditation is really, really helpful. We have been doing now for 500 odd days, and we feel really helpful for everything, almost everything we consider. First priority is meditation, because most of the people suffer from psychological stress, everything. With COVID, indoors, loneliness, people suffered enough. And that is how people were presenting and communicating and everything. And youngsters suffered more as well. You know, they couldn't stay indoors 24/7. They couldn't stay and they were really stressed. And I was dealing with several of them as well. So that's why I'm saying that. And actually it is very helpful. Anyway, congratulations. At the same time, good wishes for your future career. All right.
Thank you very much. Thank you. I really appreciate it.
Next, Bhavani Master.
Elorukum vanakkam, and thank you very much, Tharmara Kumar, your wonderful explanation and informative speech and presentation. And I learned quite a lot about the hygiene and everything in the mouth and the gum, especially the gum disease. And I was going to ask about the rinsing, but Mr. Kumarasamy asked the same question, but so I got the answer. Thank you very much. And Mr. Kumarasamy Master, thank you very much for your wonderful Tamil translation. And please come again and give another presentation on advanced, then after, I think maybe next year, you are in the third year, aren't you?
Yeah.
So maybe next year you learn more about dentistry and you can come back again and give us a more elaborate presentation.
Yeah.
Thank you very much. Thank you.
Thank you.
The next, Naraja Master, Naraja Jagannathan Master.
Greetings, everyone. First of all, thank you very much, Tharmara, for your excellent presentation on oral hygiene. I can understand the justification of not rinsing the mouth after brushing with toothpaste. My question is, in that case, you can just brush your teeth with plain water and just apply the toothpaste at another time, because in that way, you might have the fluoride, as you say, being absorbed. And is there another way the fluoride can be, utilized by the body? And also, I remember many years ago, this is in Sri Lanka, a friend of mine, friend of mine was a dental surgeon, said, don't worry about toothpaste, just brush your teeth after every meal. But I also realized too much brushing can waste your gum, isn't it? So I never did that after some time. I think I did that in Sri Lanka, but gave it up. But my question, as I asked earlier, you can just brush with water and then apply the toothpaste. In fact, when I had a little bit problem, the dentist advised me to the high concentrated, the high fluoride concentrated paste. She said, just apply a little bit and then go to bed. So she's right in a way, isn't it?
Yeah, that's absolutely fine. The main thing is that you just want to keep the fluoride on your teeth for at least 20 minutes for it to actually have an effect. So essentially what it does is it remineralizes the enamel. So that means it just helps build it up again so you don't lose it. So it has a healing effect, basically, the fluoride on your teeth. And I don't know if you're aware, but there are some materials that they use for fillings which contain fluoride, so it helps heal the pulp as well. So that's why we encourage people to brush their teeth, and we use fluoride in materials when restoring teeth because of that effect it has. So yeah, as long as you're applying it on your teeth and leaving it for 20 minutes, then you're all good.
Lastly, somebody asked this question and I checked up in Google. There's a claim, it's scaremongering, I don't know, that toothpaste have got ingredients which may have harmful effects. Is that true, or you may not be aware?
No, that's definitely a scam that people are saying. There is nothing harmful about toothpaste or anything that it contains, at least not that I'm aware of, that we've been taught at university.
Yeah, I'm aware. You don't believe everything that you read.
Yeah, definitely. Yeah, you have to source through the information.
Sure,
but
sure.
yeah, I can definitely
Thank
tell
you.
you it's nothing toxic. Yeah.
Thank you for answering.
No problem. Thank you.
Thank you, Naraja Master. Next, Srikant Raja Master.
Vanakkam. Today is our 512th day of meditation. So, first of all, I thank Saktidasan and Mrs. Maithili Saktidasan for conducting this meditation in a wonderful way. Thank you very much indeed. And thank you very much, Tharmara Kumar, for your very informative speech about the importance of oral health. And also I should thank Marasamy Pillai Master from Sydney for your wonderful translation as well. And our oral health can be an indicator of our physical health. We have spoken about how poor oral health can impair the ability to speak, smile, eat, taste, sleep, and socialize. All of the above affect the quality of our daily lives. Well spoken. Thank you, Tharmara Kumar. Thank you again for your speech. We ask that you speak to us again in 2 months' time with a different topic. Anyway, it will help us. Now I invite other masters to comment about your speech. Anyway, thank you very much.
Thank you. Thank you, Srikant Raja Master. Next, Jnanam Vijay Master.
Tharmara Kumar, thank you for your presentation about the dental care. You know, the problem is in Blackpool. It's very difficult to get the dentist appointments. 6 months, even if you wait for 6 months, I don't know if we'll be able to get it. But I don't know, the same thing is in London. I really don't know.
Yeah.
Could someone tell me, please?
It's definitely the same thing here. It's a real problem trying to get an NHS dentist, and there's just really long waiting lists. The problem is because of the way the NHS runs, they're not paying dentists enough, so they're being forced to go to private practice and do private dentistry. And so a lot of people are actually coming to our university and dental schools to get treatment from dental students. I'm not too sure if there's a university near you in Blackpool that you could try, but you have a better chance of actually going there getting treatment. But yeah, I'm sorry, it's just a real big problem with the NHS that the government just needs to solve.
Right.
Yeah.
Thank you anyway. Because we have been told to wait for 6 months, even the 6 months, anything can happen. I just wanted to ask you, they are not I mean, our teeth is not really bright white, is it? It's sort of discolored like, isn't it?
Yeah, they're slightly like yellowish.
Yeah.
Yeah, that's normal.
Thank you.
Yeah. Well, thank you.
Thank you very much.
Thank you, Jnanam Vijay Master. Next, Saktidasan Master.
Just to thank Tharmara Kumar for fantastic speech on the oral health, which is very important to everyone. Plus, you know, everyone here comes for peace of mind and good health with the aid of meditation. And on these groups and these gatherings, Mr. Srikant Raja Master have managed to bring different people, especially the youngsters who are coming over and giving their valuable speech on the fields that they are mastering, and they are doing. It's a very, very, very well effort, very good speech. And thank you very much. And we expect more youngsters to attend and give us their wisdom on the subjects. Thank you, Tharmara Kumar, and special thanks to Kumaraswamy Pillai Ayya, beautifully translated. It's very difficult, especially to translate in a speech in a specialized field. It is and to do it straight away after listening to it. It's a fantastic effort. Thank you very much. Thank you. And for everyone for participating and making this a very wonderful evening. Thank you very much.
Thank you. I have a question, Tharmara. What can be done for, when you have a receding gum, the gum recedes from the teeth. I understand it's a non-reversible. What can be done about it?
So the only way is to just stop it from receding any further, which is essentially with good oral hygiene. You'd definitely have to go to your dentist and they would have to do a cleaning professionally to actually remove any sort of buildup of plaque that there is there. And then again, they'll give the oral hygiene advice on how to improve on this. There is actually something called gum graft surgery, where they take sort of like skin from another place within your mouth, and then they can replace the receding gum. But again, you'd have to go to the dentist and they would have to check if you're be able to refer for surgery on that.
Okay. And one more thing, sorry to keep you. Eating hot, hot food or very hot drinks, does that affect the gums?
No, not at all.
It doesn't. Okay.
You can eat hot food all you want. It's just that, yeah, I was just saying that you might experience sensitivity if you have tooth decay. That's the only problem.
Okay, because I drink my coffee very hot, indeed.
Same here.
People always say that I've got a heat-resistant mouth.
Yeah, I don't know how you do it. But yeah, you're all good.
Okay. Anyway, thank you so much. Next, Darshini and Raghavi, but please unmute.
Yeah, okay.
Yes, I can hear you. Yeah.
Excellent presentation, Tharmara. You presented it very well about the oral health and how beneficial it is to all of us, no matter the age, because it's not just for elderly people, even for the people that are young, starting from a young age, looking after our teeth. And usually with the rinsing situation, most of us usually rinse it. I think it's just a habit, but keeping the toothpaste is quite important. Put on at least 20 minutes, so I've learned that, which is very useful. And also just thank you. And also thank you to Kumaraswamy Pillai for translating in Tamil. Tamil translate பண்ணுங்க. இப்போ நான் chat box read பண்ணுவேன். Time டக்குன்னு சொல்லிட்டு. Every day we are doing meditation for world peace and harmony. UK time 9:30 a.m., 11 a.m. and 8:30 p.m. Europe time 10:30 a.m., 12 noon and 9:30 p.m. Indian Sri Lankan time 2 p.m., 3:30 p.m. and 1 a.m. Australia Sydney time 6:30 p.m., 8 p.m. and 5:30 a.m. New York Toronto time 4:30 a.m., 6 a.m. and 3:30 p.m. Singapore Malaysia time 4:30 p.m., 6 p.m. and 3:30 a.m. You can work out the times for your countries accordingly. Please join. Thank you. Kailash Solirga, thank you, Tharmara, for your detailed presentation of oral health. Adandari Master Solirga, thank you very much, Tharmara, for your excellent speech. Nimi Nathan, Master says, thank you, Tharmara, for your very excellent speech. Arulam Palam, Ananda Raja Master Solirga, excellent, Tharmara. Teres Maria Das Solirga, thank you very much, Tharmara Kumar. And thank you, Kumaraswamy Pillai Master, in translating in Tamil. Take care all. Mohan Master Solirga, very excellent speech, Tharmara. Punitavadi Tangaraja Master Solirga, excellent speech and very informative information about oral health by Tharmara Kumar, and wonderful Tamil translation given by Kumaraswamy Pillai Master. Thanks very much, both of you. I also have a question. If we have time, you can answer it, or you can answer it in the next presentation we come in. do you think implanted teeth is safe to put in if some people have lost their teeth, especially elderly people? And are there any side effects for this? And if it is safe, is there like a special material? Like, is there a best type of material for implanted teeth?
Okay, so for elderly people, you can't put implanted teeth. I think the issue that some people have is the person able to take care of the implant? Because if you can't take care of your teeth, then the implant will fail and then you'll just have to have it removed and there's no point in replacing that tooth. In terms of the materials, I haven't actually learned too much about implantology yet. So maybe next year I can answer this question better for you. But yeah, sorry, that's all I can give you on that.
No problem. I think someone said like titanium or something was.
Yeah, that's one of the materials. I'm not too sure about the other ones though, but
no
I'll find
problem.
out next year.
Thank you, and also good luck on your studies.
Great, thank you.
Thank
you.
Thank you. Thank you, Raghavi. Next, Srikanta Raja Master.
Darshini Master, please note the time change, from tomorrow. That is, our 11 o'clock, 11 a.m. London time. Sydney time is 10 p.m. changing. And India, Sri Lankan time is 4:30 p.m. Please note the time, if you don't mind. Thank you.
Are we gaining or are we losing an hour?
No. That is, we are going 1 hour behind. This is backward.
Right.
Here.
Okay, thank you.
Don't confuse it. Our time is same. UK time is 11 o'clock. Europe time is 12 o'clock. Every day we are doing.
No, I'm not asking about that. I'm just asking for the time. When it's 12 o'clock, is 11 o'clock or 1 o'clock? That's what I was thinking.
That's what I'm saying.
The clock goes back.
Now you like change the time at 1 o'clock. You can change to 1 hour. Okay.
The clock goes back. That means we get 1 hour extra sleep tomorrow morning.
Extra sleep. Yeah, that's right. Yeah. So the announcement is just tomorrow, German Tamil Association, we are going to come a cultural show tomorrow at 9:30 and 11 o'clock. Lada Chandrasekhar is speaking about Mulumiyana Arogyam Patti Pesuvar. And 8:30 p.m. every Sunday, you know that Dr. Nithi Kanagaratnam is coming here to speak about pepper. And Monday, Monday, 11 a.m., Mr. Kumar Sahip's speech is there. There is life is an echo. There is வாழ்க்கை என்பது ஒரு எதிரொலியாகும். And Tuesday, 11 a.m., Harris Devda, doing versus being. Ideas on living skillfully. So that is at 11 a.m. Tuesday. So that's the way it goes. And also Wednesday, 2nd of November, cardiologist Dr. V. Chokkalingam, our patient, mind your heart. Idiyam kaakka nalamudan valamudan vaala. So don't miss just everything. It's very good speakers are coming here. Anyway, thank you very much indeed. That's all.
Thank you, Srikanta Raja Master. Next, Mr. Kamguga.
Yeah, I mean, it's a sort of a general question from Tharmara. The King's College, do they do some sort of what do you call for the graduates to learn from us, some form of participation from the general public about the oral health? Do you know about that?
Wait, is this when you graduate from university?
No. They use general public. They used to do that. General public to come in there so that they can provide almost equivalent service given by a dentist. But are they still doing it?
Yeah, they're still doing that. Yeah.
All right, that's the thing I'm asking. But that include all general oral health, including hygienic matters?
Yeah, we do everything. Yeah, from that. But if it's a bit too complex for us, we'll probably refer you to someone experienced in the hospital.
Okay, so we had to do a sort of a referral to the Guy's Hospital, is it?
Yeah, there's a self-referral form. I think they still have it online where you can fill out, or you can go in person and get a form and fill it out.
Okay, they do it in the Guy's Hospital, is it?
Yeah, in Guy's Hospital.
Okay, thank you very much indeed. Thank you.
No problem.
As the lady said, it's very difficult to get an appointment from the what do you call, dentists nowadays, even in London.
Yeah, it's really
We are talking about 6 months sometimes, you know, I can't just so much.
it's crazy.
Yeah, anyway, thank you very much indeed.
Thank you for your question.
Yeah. And I want to thank Mr. Kumar Master. He done a wonderful Tamil translation. I never ever expected a person in Australia can do this. So very good indeed. Keep it up. Thank you very much indeed. Nandri.
Mr. Kumar Master is the Australian government Tamil translator.
Yes, it's very good.
Yeah.
Well done. Thank you very much.
Thank you.
Thank you.
Next, Bhavani Master.
I want to ask a small question, clarification. You know, it's about breaking up teeth, you know, chipping away. Is it because of some deficiency or calcium deficiency or some breaking, the teeth breaking?
There's like a number of reasons for that can happen. Either they can become really brittle if you've had treatment on the tooth. That could be because of a filling, or if you had root canal treatment to treat the pulp, they become a bit more brittle. Other reasons would just be trauma, which can just happen naturally. And sometimes teeth do just happen to fracture. But yeah, there's quite a few reasons.
So will it help to get more calcium just to?
Yeah, in general, more calcium would make it stronger.
Okay.
Yeah.
Thank you. Thank you very much.
Thank you, Bhavani Master. Anybody else wants to say anything or have any doubts or questions?
There's just like one comment that says dentists say to get an MOT check of oral health yearly. I just want to say, like, normally you should see your dentist twice a year for a checkup. So yeah, every 6 months you should go. Yeah.
That's good. That's good. Yeah. Anyway, you see, I mean, it looks like the most important takeaway from this meeting is you know, we need to leave the fluoride toothpaste in the mouth for at least 20 minutes, and that's something everybody has learned here. The reason for that is most of the people here are from Indian or Sri Lankan background, where we tend to, you know, in India, I'm not sure about Sri Lanka, we tend to use a tooth powder, you know, Gopal Palpudi and things like that. So we have to completely rinse it off because it's not something that you leave in the mouth. Maybe we have the habit there. And also, we've also taught our children, even when my son was growing up, I always told him to rinse off completely after brushing his teeth, you know, so maybe because I passed on my own experience and my information to him. And this is definitely a new learning from you. And I really appreciate that. Next, Dr.Satha Master.
Good evening. I just wanted to add one interesting thing I wanted to share with everybody. I used to brush regularly, and you know what I used to achieve? I used to regular eating habit, good eating habit I learned, because once I brush, even if you bring anything from this earth, something I like most even, I won't touch it because I have to brush again. I leave it, I will leave it for later time. When I'm eating another meal or something, I might eat a little bit and then brush again. So that habit brought me to a real disciplining eating habits as well. That was really, really wonderful. I used to advise people, if you learn that habit, it's much, much better. Otherwise, you just see something and you want to eat it. You walk around in the kitchen, you see some snack, you want to eat in between. But if you have to brush, then you don't want to do it unnecessarily, just a little something in between. So by that way, you can save your teeth a lot as well and be healthy as well at the same time. You did mention about diabetes and all the sugary. Every day, almost people are coming, giving us talk and advising, and everybody is saying, but in practically, how many of us are able to do it? That's what one of the difficulty. But after coming to meditation, a lot of people have this willpower and gain their way to achieve their targets or goals. And I think most of us are benefiting in many ways. So these are little aspects useful for everybody, I think. I benefit from that all the time. I won't eat anything in between. Anyway, thanks anyway. Thank you for your presentation anyway, once again. Okay, thank you.
Thank you. No, that was really interesting you mentioned it, because I didn't actually say this, but obviously everyone's going to eat something sugary. It's in our diet always. But it's really good if you just eat it like any meal time you have, so like breakfast, lunch or dinner, and avoid just snacking on it. That will really help reduce your chances of getting tooth decay. Yeah, that was a good point. Thank you.
Yeah, thank you. Thank you, Dr. Master. And another tip that I have, because there was a time that I used to just drink black coffee, and I noticed that my teeth started discoloring. So after having a coffee, I always rinse off my mouth, and so that, you know, the stain doesn't stay. And tea is the worst thing as well. It stains your teeth very badly, isn't it? So that maybe that's also another good idea. One more thing I wanted to ask you was, you know, I've also heard that dentists are the first point of contact for any, like, you know, mouth ulcer cancer, and, you know, cancer of the tongue or the mouth or whatever. So they are the one who are best placed to discover this, isn't it?
Yeah.
So that, you know, so that's also, it's very important to have a regular dental checkup, because they can check everything else, isn't it? Yeah.
Yeah. Unfortunately, I couldn't include it all in the presentation, but I'll do another one. And
No, I understand. Of course, it's quite a lot, isn't it? A lot to take in.
Yeah.
Yeah. Thank
That's
you.
good. Thank you.
Dr. Naraja Master, you want to say something? Let me just unmute you. Sorry.
Yes, I should have mentioned it yesterday. It was a good talk yesterday as well, where the speaker did mention when a student is ready, the teacher arrives. I hope I got it right. The thing is, there's a word they use now, journalism. Every day you write. So even if you write, if you've done mistakes, you write it. But the key is that you have to realize you have made a mistake. That is a secret. So once you realize it, there's another quote I received recently. It says your last mistake is your last, the best, the teacher. So when you journal, write down, you write the mistake, so you realize the mistake, and that's the teacher. So when the student is ready, the teacher arrives. I should have mentioned that yesterday, but even if you eat a lot of sweets, you write it. It's not suitable. So you must realize it so that you won't make the mistake again. I thought I'll add that today. Thank you.
That's a good point. Thank you.
Thank you. That's very good. Yeah. Anything else? Anybody else has got any more comments? Srikanta Raja Master, do you have anything to add, or can we conclude this session?
Yeah, I think we can. Yeah, and Tharmara Kumar, you want to say anything finally now? Please tell me, and you must come again. You know that you should come again after 2 months. Also, you should introduce to your friends or anybody who who likes to speak to a platform. A lot of people and young people are coming. Yesterday also a young person came like that. Future there are a few young people are coming. So anyway, you can speak now. Yeah, you can.
No, yeah, I will let them know. And thank you very much for your questions. They were really interesting and made me think a lot more as well. And thank you for inviting me to speak. It's been a great opportunity and I really enjoyed it. So I'll definitely love to come back in 2 months' time with a bit more experience as well.
Very good, very good.
Thank you.
Thank you so much. Thank you. Really appreciate that. Yeah. Thank you. And maybe we can conclude this program. Yeah.
For the world peace and good health, we have conducted a nice meditation. Following that, a very good speech on oral health. Thank you very much, Tharmara Kumar, and thank you everyone for participating and making this a successful evening. And we will meet again tomorrow. Thank you very much for everybody. அனைவருக்கும் நன்றி, வாழ்த்துக்கள். இத்துடன் நாங்கள் முடித்துக் கொள்வோம். உலக அமைதிக்காகவும் சமாதானத்துக்கும் பிரார்த்தித்துக் கொண்டு விடைபெறுவோம். நன்றி.
Mr. Kumarsamy Pillai, you can say anything,
No, I know it was very useful because I knew mainly the rinsing part. That's a news to me because we have been used to rinsing every time. Because now I know how dangerous it is. So I still take it. It's very good advice I'm taking home. Thank you very much. And generally, very useful speech. I really appreciated it, and I got the opportunity to translate it. It's a wonderful experience again. Normally, the technical words are there, so I managed to get it across, and thank you very much for the opportunity. As usual, I would like to thank all those people who meditate, and we are improving day by day, and the day will come, we will have peace all over the world. Thank you very much.
உள அமைதி மருத்துவம், அதுக்கு நல்ல ஒரு இங்கிலீஷ் டிரான்ஸ்லேஷன் சொல்லுங்க பாப்போம். Because people won't come here if you say meditation. So like that we changed the name to உள அமைதி மருத்துவம்.
Yeah, actually, that's the nowadays you can see the even medical profession, especially counseling, they are encouraging all those mental patients to live in the day-to-day. That's why it has been introduced. The dictionary they say so many meanings. That one is Ula Amati Marathon. That's actually the meditation is the therapy for people who have been affected by mental illness. So we have to accept it. Because when you say Dhyanam is a really a Sanskrit word, it has been introduced. And this gives more meaning when you say, and another Tamil word is Andha Sindhane. Actually, when we do engage in the full 100% focus on things, we won't think about the past mainly. There's a past is holding us. In the future, we are scared about the future. So it's better to dedicate the time, every moment, whatever we do, all 24 hours, we are meditating. So when you are focused, another word is the concentration. Actually, when we can concentrate 100%, our mind will not lower around. So that's what the advantage of meditation. Especially nowadays, younger generation should adapt daily as a habit, because because we, of course, we have spent our time couple of years more, but actually this meditation will help the younger generation. And I would appreciate your service to the younger generation. Thank you very much for the opportunity. Thank you.
That is big.
Yeah, that's good.
Yeah,
yeah, actually, meditation is something that even the Western people, they use the word meditation. I don't think people are really put off by that. Mindfulness is another one. Most of the big companies, the motivational speakers and even organizations, they organize, mindfulness sessions and things like that for everybody. So it's already there. The only thing is, dhyanam, the Tamil word, maybe dhyanam is putting off the Tamil people, maybe, I don't know. But I think English people are using meditation. They're not scared by the word meditation. It seems to be very prevalent these days. That's my experience of it. Yeah. And I'm sure Tharmara will agree that a lot of younger people now are using this. In schools, they're doing meditation as well nowadays, doesn't it?
Yeah, that's so true. They say it helps a lot with studying and like retaining more information. So yeah, everyone's definitely getting into it.
Yeah, I mean, like, they call it a relaxing technique or meditation rather than our conventional anapanasati meditation. So whatever it is, they're all, relaxing and doing some benefit to the body. And Saro Sundaralingam Master wants to say something. Unmute panni vidumo.
Thank you. Welcome. Greetings to all. Tharmara Kumar, you gave a very insightful speech on oral health, which was very useful. As Mr. Kumar Swami Pillai mentioned, a very good insight into why we should not rinse soon after brushing with toothpaste was a very useful information. Thank you very much. Your speech was very good, very clear, and you very clearly explained the importance of oral health. Thank you very much. Now I would like to make a comment. Dr. Srikandaraja Master asked, உளவியல் மருத்துவம் என்பதற்கு தமிழில் எப்படி உளவியல் மருத்துவம் என்றால் ஆங்கிலத்தில் எப்படி கூறுவது? உளவியல் என்றால் எந்த அறிவுக்கு அது psychology. Now மருத்துவம் is healing, psychological healing என்ற சொல் சரியாக இருக்கும் என்று நான் நினைக்கின்றேன். அது தவறாக இருக்கலாம். உளவியல் என்றால் psychology, மருத்துவம் is for healing, that is medication is for healing. மருத்துவம் அப்ப psychological healing of your mind. உளவியல். I don't know whether that is correct, but I'm just
psychological therapy.
Psychological healing, that's a therapy for your mind. Meditation is a therapy for your mind.
So instead of healing, you're saying therapy instead of healing.
Okay, then psychological therapy we say. Okay, all right.
So we can say in future like that, if you say meditation, especially the Tamil people, they are not coming, if you say meditation, but we are doing, is a different way we are doing, That is,
okay.
we are playing the music and, just observe your breathing. That's all, nothing else you don't need to do.
I just
focusing on the present moment. That is the word we are.
That is the important thing, focusing on the present moment. Okay, Dr. Narajendra Jagannathan is there, I think. Yeah.
எனக்கு என்னவோ நிவாரணம் என்ற வேர்டு தான் கூட பிடிச்சிருக்கு. அது தமிழோ சமஸ்கிருதமோ தெரிய இல்லை. என்ன நிவாரணம் என்றால் தான் ஹீலிங் தெரப்பி என்று வரும் என்று எனக்கு அது அப்படி படுகிறது. ஆனால் மருத்துவம் என்றதையும் எடுக்கலாம். என்னென்று சொன்னா நான் எடுத்து பார்த்தலாம் டிக்ஷனரியிலையும் நிவாரணம் என்றா என்னண்டு. ஆனால் அது பொதுமுறையில் நாங்கள் பாவிக்கிற குறைவில்லையா நிவாரணம் என்று.
Actually, this word has been introduced by virtual dictionary. The Annamalai Madras University has published a dictionary. I got this word from that because they have used the word Ulaviyal Amadi Marthuvam.
அதில் என்ன கன்ஃபியூஷன் சொன்னா மருத்துவம் என்று சொல்லிக்கலே அது இட்ஸ் a broader spectrum இல்லையா. அது it involves research and everything. It's moving on. அப்ப நிவாரணம் என்றைக்குல I think அது restrictive. மாத்தோணும் இல்ல இல்ல நாங்கள் என்னன்னு சொன்னா யாராவது எழுதுறது ஆக்கள் தானே. ஹூ இஸ் த அல்டிமேட் பர்சன்ன்றதுதான் கொஸ்டின் வரும். சில வேர்டுகளுக்கு அவராதிலே தமிழ் இல்லை. அப்ப ஏதாவது பொருத்தமே நாங்கள் எடுத்து போடலாம். அப்படி பார்க்கல நிவாரணம் என்றது அது தமிழோ சமஸ்கிருதம்னு எனக்கும் தெரியாது. அதுக்கு தமிழ் பண்டிதர் தான் கேட்க வேண்டும். எனிவே இதோட நேரம் ஆகிவிட்டது. Thank you.
I have a question to Tharmara, actually. Something always been puzzled me that, English people, they always have the breakfast in the morning and then brush their teeth. Whereas we Asians, we tend to do it the other way. So, my younger generation are saying that because we're brushing the teeth and sleeping at night, might as well have the breakfast and clean the teeth. So what is your opinion about that? Which is advisable?
It's better to brush your teeth first before you eat breakfast. The thing is that when you're sleeping, you build up bacteria during your sleep. So if you then eat straight away, you're just like, it's all sitting there and you're eating. And then people also just brush straight after eating their breakfast. And you need to wait at least 20 minutes after eating to brush your teeth. Otherwise, you're going to wear away your teeth even more. I agree. The way that Indian and Sri Lankan people do it, you should brush your teeth first and eat breakfast.
The Western people do it differently. So I never know which is correct. Are we being over, engineering things in the Asian countries, I thought. Okay.
No, yeah, we're doing it right way.
Yeah, okay, that's good. Thank you. Thank you. Next, Dr.Satha, Master.
Good evening. Anyway, once again, I have come. Actually, prevention is better than cure. So what we need to aim is, we have to, after eating, we have to clean anyway. First thing you do, whatever you are doing, but then every meal, if you have eaten something, that's why I was saying that you have to brush your teeth. Otherwise, all the food particles go in and within a few minutes, all the bacteria will grow. About the meditation bit, another name you all were discussing, I was wondering, prevention, not everybody is coming up with problem. You're not treating them with meditation.
Exactly.
Preventing as well, preventing and trying to realize what we need to know, what we need to learn as well at the same time, and we benefit a lot. And I was going to give an advice to Tharmara Master now. As a student, definitely if you do meditation, you will go a long way in concentration and mindfulness. I always advise to the future generation, a lot of people I have contact with, and I always advise them, and you will perform much, much better. Your memory will be better. You will be really achieving sky high things, whatever you set up a goal and work for it. And with meditation plus, it is much easier to handle anything. You can deal with anything. And your presentation today, another thing I was thinking, you can put in your CV. You can put a title that you did a presentation in this kind of thing, all take you long way.
Thank you very much for the advice. I definitely will continue starting meditation actually. Thank you.
Thank you, Dr. Satha Master. And the Darshini Master, please unmute.
Hello again. I got a question again. So as humans, we brush our teeth, right? And we try to keep our clean by brushing our teeth. How about animals? Like cats, dogs, cows, I don't know, they eat grass. How do they clean their teeth?
That's a good point. I think the main thing is that with humans and currently now we eat a lot of sugar and processed food. And that's really the main thing that is causing tooth decay and wearing away our teeth. So essentially, if you never like actually had any processed food or ate any sugar, you wouldn't really need to clean your teeth. That's kind of why animals don't have to, if that makes sense. But yeah, that's what I've read so far anyway.
So if we eat like animals, we don't need to brush our teeth.
Yeah, technically, because there's not really like any sugars that's going to cause a lot of tooth decay.
Yeah.
So yeah, if you can avoid sugar, then you're all good.
So just like what Dr.Satha said, prevention.
Yeah, prevention's key and way better than treatment.
Thank you again.
No problem.
Good luck.
Thank you.
Thank you. Thank you very much. I think we've come to conclude the session today, I think. Shall we conclude this, Kandaraja Master?
Yeah, just.
Yeah, okay. Thank you. Thank you very much, everybody, for coming, for attending this wonderful session. And thank you, Tharmara. And it's really an eye-opener. We here definitely have learned at least one thing. Brush your teeth and leave it for 20 minutes. So I really thank you very much for everybody. And we've had a wonderful meditation session, and we'll continue these sessions in the months to come, in the years to come. Thank you, and have a good evening.
Thank you.
See you tomorrow at 9:30 a.m. UK time. Huh? Thank you very much.
Okay.
Thank you. Bye-bye.